was feeling bad all the time. And hard-headed, I just put it off, you know, something. Then all of a sudden I started feeling strange. So that's when I started going to the hospital.
Many patients will not tell you that they're struggling. That's why they end up in the emergency department in the first place. They have financial difficulties, so they can't pay for their medications. Or they have transportation difficulties. They can't get to the doctor or health services. So oftentimes they'll call an ambulance and come to see us, even though this is something that could be handled typically, you know, in a doctor's office, and we see that a lot.
His truck he couldn't afford to fix, to go on the bus, which is the next thing we always ask, but he had to walk 2 blocks, and he couldn't do that with his chronic lung and heart condition. He then identified that they had tried to use the cab system, but it cost $40 round trip, and he didn't have that.
So frankly, you have to take a little bit extra time with these people and actually delve into a little bit and speak to them and say, hey, are you struggling for some reason? Is there some reason that, like with Gary, his blood pressure was high and his blood sugar was high? Things that were chronic conditions for him, but he was struggling to manage them at home. So you delve into that and you figure out why are you struggling and how come your diseases are out of control right now. And once you get down that road a little bit, you can figure out, hey, you know what, his numbers are bad tonight, but I think with a little bit of extra care, we can keep him out of the hospital.
So I did call and communicate as well with the family medicine clinic and said, here's what we have. He simply cannot make it. I have the ability to go out and see him at home. What I'd like to do is collaborate with you to provide care for him, and I'm open for any suggestions.
When I met Gary, he was referred to us after an ER stay. When I got to the home, did a comprehensive assessment, identified some symptoms that could, without timely intervention, send him right back to the emergency room or a hospital stay.
In an emergency medicine setting, we want to take care of the acutely ill, and not that these other problems are not important, but the emergency department is not the appropriate setting for chronic disease management. This is one of the worst places to get your chronic, or I should say your ongoing health care. You don't want to get your ongoing health care from an emergency department. I don't know the patient. I'm not the patient's doctor. It's episodic care.
I made the call to Deb Myers and the house call service, and she was able to see him.
He wasn't moving around near as much, didn't really have a focus on getting better. I think he was just trying to kind of decide how to get through the day.
When we meet people in their homes and we see what their lives are like, and sometimes the family is there to talk to them and say, what do you really want? Is this what you want? So that's a component of it too. You get to know the patient, you see their life, and you see, this is why none of it's working. This is why all of the resources we're throwing at you aren't working, because you're the object of the care and not the person driving it. So this is a way to put people in charge to help them manage their own care.
And what I've found is that people just want something to be in control of. And so when you're in their home, they truly do have control. They don't even have to open the door when you go if they don't want to. And so I think that what you find is that once you give them some control things and teach them to do that, they just excel. I'm just amazed at how well some of these people do.
And once you teach a patient how it affects them, they usually buy right into it because they want to be healthy, they want to feel good.
I think when I go to see him now, he's brighter. He told me today he's only using his oxygen 2 or 3 hours a day. When I first went to see him, he was using it continuous.
Well, these are one of those success stories because, you know, oftentimes patients will continue to come back to the emergency department.
It's hard to find anybody that cares for you like they do. She's just like the nurses. She worries about me. They come out there and they worried about me. Nobody ever done that. And it just makes you feel so good.